more on the situation at the Al-Shifa hospital in Gaza. Let's bring in Dr. Margaret Harris. She's a spokesperson for the World Health Organization. Good to see you, Dr. Harris. Thanks for joining us. Now, doctors say Israeli forces ordered the evacuation, but Israel denies this, saying that they had agreed to an evacuation request from the hospital's director. If this is something that had to happen, as it has, what has the WHO been calling for to make it as viable and as safe as possible?
Hello, Sally. Well, what we really needed is to see a cessation of hostilities so that people who need to come out can come out safely, but also a means of transporting the sickest. We know that there are a significant number of patients remaining in the hospital because they simply cannot be moved unless they're moved with the greatest of care, with the sort of level of care that you would get with an intensive care ambulance. And as you know, there's no fuel, there's no ambulances, there's no safety to do these things.
So what kind of information have you had from the IDF in terms of trying to manage the patients that are currently in the hospital? What do you know about how many medical staff are there, and how much communication do you have with those that you need to talk to about the conditions?
So we've not had communication actually from either of those sides. We do try to get in touch with people inside Al-Shifa, but communications have been extremely difficult because, again, the lack of fuel means that the communication systems are very poor at best. So really, for any help we can give, we are simply waiting and really watching in horror at what's unfolding.
So what about for those who are en route to the south, who have left the hospital with various conditions, and the staff from the hospital too? What do you know about their situation, how they're being supported, you know, what some of those patients might be suffering, and some of the risks for all those involved that have now left?
They must be suffering enormously, even if they're not patients. Remember, we've had a large number of internally displaced people who've been without food and water for days. Nobody who will be moving, and they will be moving on foot, will be in good condition. This really will be a walk of great suffering.
And what about in terms of hospital services in Gaza? How much do you know in terms of, the services available to those that need emergency attention? You know, do you have many staff on the ground that are trying to access these hospitals and support the hospitals?
Yes, indeed, we do have. Our team in Gaza have stayed there despite the terrible fear and the night after night of bombing. They haven't really slept for 5 weeks. What we know is the hospital services are just dwindling by the minute. That, again, there's so little many of the hospitals can do because they lack power. So they're reduced to really providing not much more than a first aid. The other thing is that the number of hospital staff are being reduced simply by being killed. We know more than 200 healthcare workers that have been killed in the bombings. And the other thing that's going on is a big rise in infectious diseases. We're seeing a rise in diarrheal diseases. We're seeing a rise in respiratory illnesses. Now, those people can't actually get to hospital, but they are getting sicker and sicker. And the other group are women, pregnant women, who at least 200 are giving birth every day, most of them not in hospital, most of them wherever they are, is, I hope, not in the street, often in shelters, but with no pain relief and no means of keeping their newborn babies clean and warm once they're born.
In terms of the broader scale, the WHO has a strategic plan that calls for a huge logistical undertaking, not to mention the cost and safety concerns associated. What does that plan entail, and where are you in terms of where you want to be in achieving those goals?
So we're ready to go in. We've got staff, we've got people. We're not as funded as we'd like to be, obviously. This is going to be an enormously costly operation. But we have the aid flowing, except it flows as far as the border. What we can't get is get it in because the fuel is not being permitted in. So the trucks that can take it to the hospitals and other places can't take it. The other thing we don't have is safety. We don't have protection. We're seeing healthcare violated every day. And until there's a ceasefire, we really can't do what we know we must do. There is so much we must do to help.
All right, Dr. Margaret Harris, we'll have to leave it there. Really appreciate your time.
Thank you.